The lack of bed space at Ashanti Region Only Referral Hospital with its attendant strain on health delivery is giving rise to concerns about progress of work in 5 major health facilities at various stages of completion in the region. Facilities at the Komfanochi Teaching Hospital, Kumasi South and Mensha Hospitals are overstretched, while stalled hospital projects at Sewa, Fari, Konongo and Fomena could provide a total of 1,850 bed space. The recent death of a 7-month-old baby at Kat due to the no-bed syndrome has got residents questioning the slow pace of work on these health facilities. Love FM's Erastus Asaridonko has more.
Little Efia Sika Opoku Jemfi had breathing problems and was referred to the Komfanochi Teaching Hospital from the Asukwa Children's Hospital. Her father, Francis Opoku Jemfi, says his daughter gasped heavily for breath every 30 seconds, even under oxygen at his first port of call.
I couldn't stand the situation, so I was...
Health professionals at the Asukwa Hospital later informed Francis the Komfanochi Teaching Hospital lacked space to accommodate her sick daughter.
The way she was breathing and she would be shouting, at least every 30 seconds. Whoa. And I asked about the man in charge, the doctor or the PA also. So, what are they doing? They say they have called the ambulance service. They have called the ambulance to come and take her to Komfanochi. Komfanochi says there's no bed to accommodate my daughter. So I should wait, or they should wait for next morning.
She died. Little Sika represents many who lost relatives due to lack of space and an overstretched single referral point for Ashanti Region and beyond. Public Relations Officer for the Komfanochi Teaching Hospital, Kwame Frimpong, indicates the hospital's facilities are overstretched.
If you come to the National Emergency Center, for instance, the orange unit, which was supposed to be catered for 12 patients, we've added beds to the extent that at times you come and you see up to 56, 48, 52 patients in the space that was given to us for 12 patients. Until we are reached that point where we have complementary facilities to take some of the pressure off Komfanochi Teaching Hospital, there will be times that we will have exhausted our capacity and we will not be in the position to admit additional patients.
Perhaps the solution to providing a second, third or fourth alternative to healthcare in the Ashanti region lies in the completion of health projects at Sewa, Konongo, Fomena and Ferry. Residents are worried about the current situation.
To build 111 hospitals now, whereby we have abandoned projects in the bush, I think we need to complete those things before we start new ones.
Works at these facilities are between 80 and 90% complete.
Closely, we've invested about $500 million in these facilities.
Eugene Oseitutu is a fact checker.
When you take a Ferry Military Hospital, for example, the process was started during the twilight of President Kufuor's administration in November 2008. It's almost 14 years now, and it's not been completed. When you take Sewa, the land was handed over to the contractors, the Eurojet people, in 2015. So it was supposed to be completed in 20 months, so somewhere around 2017, but they stalled. Clearly, when you are coming back to such a facility, you need extra cash. So it means that you inject more money when it comes to some of these finances.
When completed, they could provide a total of 1,850 bed capacity to boost the Ashanti region's ailing health delivery drive. Reporting for Joy News, Erastus Asaridonko, Kumasi.